My name is Brenda August, and I'm a member of the City of Bowie's Community Outreach Committee. The committee is pleased today to present a panel from the Prince George's County Department of Family Services, Mental Health and Disabilities Administration. This panel will discuss mental health and mental illness today, resources that are available in Prince George's County for those persons who are affected by mental illness. I'm very happy to present Mr. Raymond Watson. Mr. Watson is the Adult and Elderly Coordinator. Mr. Charles Bond. Mr. Bond is the Director of the Crisis Response System. And Mr. Timothy Jansen, who is the Executive Director of Community Crisis Services. Before we begin our discussion, Mr. Watson, I'd like you to help us clarify two terms. We want to be sure that our listening audience, our viewing audience, really understands the difference in some of these terms. Tell me the difference between mental health and mental illness.
Okay, with mental health you have changes in mood, thought, and behavior. And those are impacted when a person is not able to think clearly and just seem to be having some disturbances in just their basic thinking pattern and behavior pattern and mood. What I always like to let people know is that prior to making a diagnosis of mental illness, it's really important for them to go to their primary care physician and have an evaluation to determine if the changes are a result of some medical condition versus a psychological condition. But most often in mental illness, it's a severe disturbance of the thinking process, the mood process, and the behavior process. And when that occurs, your primary care physician most likely will make you or give you a referral to your psychiatrist or to a psychiatrist who can further investigate exactly what kind of psychological disturbance is going on. So I hope that helps.
Thank you very much. There's another concept that I want to be sure that we're clear on. What do we mean when we say wellness and recovery in mental health?
Well, wellness and recovery in the state of Maryland is speaking of looking at our system and transforming it into a consumer, family focused system in which not only the policies from the state and management kind of listen to the needs and desires of the family members and individuals actually using the service. The wellness component is looking at the idea that people with mental illness can recover if given the correct and appropriate supports. And we see this in our system where we have peer-run support groups where consumers support each other, and they're supported by my office and through the state of Maryland, the Mental Hygiene Administration. And what we see is that through the peer support system, people with mental illnesses can have normal lives. They can work, they can own their own homes, they can go back to school and get their degrees. And so the wellness part of it is where hopefully we're going to be down the road. And we're just moving into that through a grant that was given by SAMHSA to provide funding to help the system move more towards wellness and recovery. That's
wonderful. There's hope.
There's hope. Yeah, yes, there's hope. Yeah.
That's great. Well, I understand that the area of the Department of Family Services that you're responsible for has a variety of programs for persons who are affected by mental illness. Can you tell us about those programs and let us know what services are provided? How does one get information on it? We'd also like to know if who's eligible to apply for this, and how do we go about applying?
Okay.
And of course, we always want to know about cost.
Okay.
Everyone wants to know
Yeah.
how much is this going to cost me? So why don't you review those programs for us?
Okay, that's a lot of questions.
That's a lot of questions,
But
yes.
we'll start with some of our main programs, which is sort of the foundation of the public mental health system. Primarily, we talk about psychiatrists and therapists, and you'll find those individuals in outpatient mental health clinics around the county. And those services, for those services, if you sense that you may have a mental illness or you're having mental disturbances, you can always contact my office and we can help get you linked to those types of services. For people who have been diagnosed with mental illness and live at home or live by themselves and they're not working or they're not able to work, we have what we call psychiatric rehabilitation programs. And in short, those are called day programs. At the day programs, at the day programs, individuals are sort of helped to understand their illness. They're encouraged to participate in ongoing treatment, to meet with a therapist on a regular basis, and to socialize with other individuals who have similar conditions to themselves, so they don't feel isolated. Another service, as you move through the day program system, you can consider is the supported employment program. And that's for individuals who are in recovery, as we discussed earlier, and are ready to work. And this system really takes a person from writing a resume to skills assessment for jobs or careers, and then all the way through the process of finding an employer, getting hired, and getting on-the-job supports from a job coach. And those are some of the primary services that are sort of the foundation of what the public mental health system offers. There are many other services that are available, and I think later on you're going to go into some of those other services.
Is there a cost involved in some of the services you've discussed?
Okay, the cost is for individuals who want to access the public mental health system. Most individuals have a low income or have medical assistance, and that's how these services are paid for. If you have low income, most likely you'll be eligible for medical assistance or primary aid for adults, which is another insurance that you can get through the state of Maryland. If your income's a little bit high for medical assistance, but not high enough to get you other insurance, there's another type of insurance that you can get that will help pay for these services. So in essence, it's not money that comes out of your personal pocket to be able to access the service.
Is your income level the major eligibility criteria, or are there other criteria?
There are other criteria that the state has established, and the primary criteria is that you must have an Axis 1 mental health diagnosis, and it needs to be a diagnosis that the state has deemed appropriate for these types of services that the state is willing to pay for. So it's not every diagnosis in the diagnostic criteria, DSM-4, but there are some specific diagnoses. They tend to be things like schizophrenia, bipolar disorder, major depression, and another diagnosis, we call it co-occurring, which is a mental illness with some substance abuse, a combination. They tend to be the diagnoses that are that really impact a person's life.